we're working towards stage 2. We've got all the software installed at this point. We're working towards our workflows. We hope to begin our attestation period here in the second quarter so that we'll be ready for probably most likely a July actually entering our attestation.
When you're in a hospital, I know the physicians make a lot of decisions about your care, but it's really nursing that delivers the care to the patients. And so one of the things that was important to Southern Illinois Healthcare is that we have consistent, high-quality care with our nursing staff and with the processes they were going. And so we thought that having standardized, evidence-based processes was key to having consistent quality, consistent results, consistent good outcomes with patients.
So when we look at ICD-10, meaningful use, ACA, the HIPAA omnibus rule, providers are getting to the breaking point. IT professionals sometimes are on the receiving end of that frustration. And so I have to give advice like, don't worry, it's going to be okay. These will be the times we'll tell our grandchildren about. Don't look at your position, look at your trajectory. Think of how much we've done over the last 4 years and how the next 4 years will bring safety, quality, and efficiency. You will survive.
Okay, we're a 2-hospital system with a very large PHO. Right now we're going through a Epic implementation, so we're switching out our EMR, replacing 34 different systems, and at the same time we're also installing Orion HIE for our care coordination as well as meeting our ACO MSSP shared savings program needs, requirements.
So the HIPAA rules are, the privacy and security issues are number one. Have to be. It's our responsibility to keep our patients' records safe. And I'll tell you, the change in the rules has been very, very difficult. So top of mind. Cerner's obviously right out there is a big deal, and that solves some of our meaningful use issues as we look toward the future. But we don't get paid without ICD-10. And then that's why we're not going to even try to attest in 2014 to meaningful use, because our energies are going into ICD-10 and security. Cybersecurity
is a thing that as a single provider institution, but frankly as an industry, we need to take more seriously. These threats are real, as I can tell you now from our experience, not just from the point of view of potentially breaching and accessing data for various purposes, but also just with respect to being disruptive to clinical operations.